Good morning, everyone. This is Dr. Khraizat from Michigan Women's Care in Canton, Michigan. It's a beautiful day in April in Michigan, and I was going for a walk this morning. When I came back, I had the usual symptoms of seasonal allergies: runny nose, stuffy nose, itchy eyes, irritated eyes, and this happens to me on a yearly basis right around the same time. And been practicing obstetrics since 2003, and many of my patients have complained of the same symptoms. So I thought I'd put this together to help out pregnant women who suffer from similar symptoms. So obviously the best time to evaluate for seasonal allergies, or what is it that makes you allergic or have those symptoms, is before you got pregnant, because then there could be some sensitivity testing and some allergen testing. But if you already find yourself pregnant and it is during the seasonal allergy time frame, then we try to avoid allergen testing unless it's severe allergies. So if it's not severe, mild to moderate, then obviously the best thing to do is to try to avoid the allergen if you know what that is. Other stuff that we can do that is non-pharmacological include using nasal lavage. And nasal lavage is instilling a couple hundred milliliters of usually saline to wash out the nose and the sinus cavity on a daily basis or on an as-needed basis. And it really works well, and it's safe during the pregnancy, and it's a nice non-medicinal approach to help out with such symptoms. Another thing that you can do is you can use some of those nasal strips that help keep the nasal nares open, especially at night, to help you feel less congested and less stuffed up. Another option that you have, if it's irritated eyes or itchy, watery eyes, we can guide you on the use of some eye drops, or we can prescribe some eye drops. Many of those are over the counter. If you have skin manifestations due to seasonal allergies, sometimes some topical creams like Benadryl or some topical steroid creams we can recommend to you to use. But if it's mainly in the airways, like in your nasal passageways and the runny nose, then we can prescribe or you can consider over-the-counter antihistamines such as Claritin or Zyrtec. Those are second-generation antihistamines, less drowsy than cause less drowsiness than the traditional first generation like Benadryl, and those are okay to use in pregnancy if we have to use them. We can also prescribe them if necessary. There is a set of medications that use nasal steroids, sprays, that we can also prescribe, or you can buy them over the counter now, and one of them that people may recognize is Flonase. Bed elevation is a non-pharmacological option that you can use. You can elevate the head of the bed 30 to 45 degrees just to help that drainage go away as well. We try to avoid oral decongestants if possible, especially in the first trimester of pregnancy. Please discuss with your doctor or with our practice if you are considering using oral decongestants. If the symptoms of allergic rhinitis sometimes become more severe and we suspect a acute sinusitis, like a sinus infection, and if it's bacterial, that needs to be seen in the office and evaluated in the office so we can determine if it's necessary to refer to an ear, nose, and throat or a primary care physician. There is a condition that's specific to pregnancy called pregnancy rhinitis, which gives you the usual symptoms of seasonal allergies, but mainly concentrated on nasal drainage and discharge, and it usually lasts for 6 weeks or more and resolves within 2 weeks of delivery. That one is more due to hyperemia or swelling of the nasal passageways. And the reason there's hyperemia or swelling is because you carry more blood in your body when you are pregnant, and thus you get more swelling. You may remember that you get some swollen gums. You may brush your teeth and get some blood on the toothbrush. That's all because of hyperemia, because you're carrying more blood in your body when you are pregnant. The pregnancy rhinitis, that chronic condition 6 weeks or more, doesn't usually respond to medications like seasonal allergic rhinitis does. But at least if we educate you about it and give you some non-pharmacological options, you may feel better. If your symptoms are severe, or if they're not manageable by these typical over-the-counter or non-pharmacological options, then I may recommend that you be referred to see an ear, nose, and throat specialist or an allergy specialist or a primary care physician with interest in allergies. I hope this information helps. These can be very bothersome symptoms, but there is multiple options that you have for management of them. If you have any further questions, please reach out to our office, Michigan Women's Care. We have been delivering excellence in gynecology and obstetrics since 2003, and we have a beautiful office in Canton, Michigan. You can reach us at 734-981-8181, or our website is www.michiganwomenscare.com. I hope this information has been helpful, and I hope you have a safe and healthy pregnancy. Thank you.